Gonna wait just a moment. Okay. Uh, I'm gonna start again. Good afternoon, everyone. This is Andy Reese with Department on Disability Services. As always, I will start today with our data. So we have had one more COVID diagnosis this week, bringing our total since the beginning of people supported by DDA who have contracted COVID-19 to 429. Once again, unfortunately, this was a person who has been regularly counseled about the benefits of vaccination, but to date had refused. And so unfortunately, they've contracted COVID-19. And they were in a host home, bringing that total in host home who have contracted COVID-19 up to 9. In intermediate care facilities, 114. In a mental health facility, there was 1. In natural homes, 56. In nursing homes, 2. In out-of-state placements, 4. Residential habilitation placements, 37. And in supported living, 206. So by placement type, the 114 people in ICFs represent about 38% of people who are in ICFs who have contracted COVID. And of those 38 people, there have been 12 deaths that were confirmed. Of those 148 people, so 114 people, there have been 12 deaths that were confirmed as COVID deaths, representing about 10.5% of people who had COVID in ICFs who died. There were overall 23 deaths, but as I said, only 12 of those are confirmed as COVID deaths. In natural homes, the 56 people represent about 6% of people supported in their natural homes who've contracted COVID. And of those, there have been 5 who have died, all of which were confirmed as COVID-related deaths, representing just about 9% of the people with COVID in natural homes. In residential habilitation, the 37 people who've had COVID represent about 34% of the people in residential habilitation who have contracted COVID. Of those, 3 have died, but only 2 were confirmed as COVID deaths, representing about 5.4%. In supported living, the 206 people who have contracted COVID represent about 22% of the people in supported living. Of those, 21 have died, but only 15 are confirmed as COVID deaths, representing a little over 7%. So overall, the 429 people supported by DDA who've contracted COVID represent just about 18% of people supported by DDA who've contracted COVID. And of those, 36 have confirmed COVID-related deaths, representing about 8.5%. And there are an additional 20 people, some of whom the cause of death has been confirmed as not COVID-related. And for 12, it's confirmed as not COVID-related. And for 8, we are still pending the cause of death. So in the month of May, tracking just by the large placement types, there have been no COVID so far because the one COVID infection in the month of May was in a host home. People who've required inpatient care who were diagnosed with COVID, 0 so far in May. And there are currently no people hospitalized. There was one person who died in May who had contracted COVID actually about a year ago. So that is among the 8 people who are um, for whom we would be awaiting confirmation. Pretty unlikely that that is related to COVID, but we will await the OCME finding regarding the cause of death. As I said, 12 had been confirmed as not COVID related. And so overall, there have been 36 people confirmed as having died from COVID, the last one being in March of 2021. We did have additional staff who tested positive. There have now been 694 provider staff who have tested positive for COVID, 51 of these who work for more than one provider agency, and we have lost 10 staff to COVID. What the part of what this really points to is the importance of being vaccinated. As I said, unfortunately, the one person who contracted COVID this month has been counseled about regularly the benefits of COVID vaccination. We overall, within the population of people supported by DDA, are doing quite well in terms of people being vaccinated, particularly in congregate settings, in the intermediate care facilities and residential habilitation. In ICFs, we're at 96%, and in residential habilitation, we're at 92%. When supported living is at 78%. We still have a little ways to go between documentation and ensuring that people are getting vaccinated amongst people who live in their natural homes. That's still just over 50%. It's at 53%. However, overall, as I said, within the people supported by DDA, we are at 70%. Unfortunately, amongst the staff, the provider agencies report every 2 weeks, so I have nothing new to report since last week, but people may recall that amongst provider staff, we are still overall at 42%, which is far below where we would like to see that number. As I have said, that is a full range from as low as 9% with some providers all the way up to 100% with some providers. So we do see quite a range in terms of different agencies' success with having their staff recognize the importance and the benefits of getting the COVID vaccine. I am quite certain that people have heard the news from the CDC regarding the updated guidance about masks. Just as a reminder for people, the public health authority for those of us in the District of Columbia is the DC Health Department. And so what we will continue to watch in terms of guidance about appropriate mitigation, appropriate steps that we need to take in order to ensure that we all stay healthy and safe in the district is looking at coronavirus.dc.gov and following the health guidance that is there. The CDC guidance informs the DC health guidance, but the ultimate authority in the District of Columbia is the DC Health Department and, of course, the mayor of the District of Columbia. And when you go to coronavirus.dc.gov, you can see the various mayor's orders, as well as the updated DC health guidance. Since last Friday, there's no updated DC health guidance. So, we do have a presentation today from some of our folks from Project Action, Leonard Stevens and Jermaine Payne, will be doing a presentation today. And I just want to make sure that they are here and panelists and available to start, and then I will go ahead and put up the slides for their presentation. I do see Leonard, and I know that I believe Jermaine has called in.
Just to verify,
Yeah.
can you hear us?
Okay.
So,
Yeah.
Leonard, we can hear you, correct?
Correct.
And is Jermaine with us yet?
Yes.
Oh, it's right
Welcome,
there.
Yeah.
Jermaine. So, give me 1 second, and I'm going to put up the folks from Project Action are going to share with us some of their lessons learned in the last year. And so I'm just going to share that screen and turn it over to Jermaine and Leonard.
Okay, Jermaine, you want to start?
You, Mandy. Okay. Part action lessons learned during COVID-19 include: one person learned what he could do to make himself feel better. But after the COVID shot, because he didn't feel well, all of us learned more about how to use computers and use them for advocacy, to participate in meetings, to testify, learn how to protect yourself and others, to support others who are isolated and lonely, how to stay active and with exercise, to continue with all of the projects we work on, to do training and more. One person said he learned how to make the best of it. And Leonard will be taking over.
Okay, thank you, Jermaine. That was good. For Project Action, for Project Action's lesson learned, someone else said that he learned how to be patient about wearing a mask and staying distant, which is 6 feet apart from everyone. Plus, we learned that we can still hold our monthly meetings and get 70 or more people to join. So that means we appreciate Mr. Andy Reeves being patient with us and taking the time to educate us about what's going on, considering we're about to reopen real soon. Also, we learned that the people that still have to use their own common sense about going out and doing things. And that is the key word I'm going to use for today, common sense.
Thank you. Thank you.
Thank you all.
Okay, thank you very much. And, you know, they talked about all the things they've learned about using technology. Next week, Donald will be providing us an update and an overview of some of the training that we will be providing regarding technology to help our providers become even better at using remote supports to help people become even more independent. And so I'm looking forward to hearing about that, as well as that certification process for providers. I know we have one provider at least that's already gone through that. So we will hear, I think we'll hear more about it, although I'd be happy, Donald, I see as a panelist, so I'd be happy for Donald to share anything he would like to right now about that.
Figured I'd pop up and show my face today. Good afternoon, everyone. Those lessons learned are very valuable first and foremost. Not only that, it's reassuring to me as I continue to try to work on the Tech First initiative, hearing from Project Action. And I'll get to that in a minute why I say that. But yes, Director Reese, as well as us focusing on rolling out enabling technology education program to our providers. We were lucky enough, we were hoping just to get 4 providers in response to this opportunity. Providers went above and beyond. We received 20 responses from providers. And with that, we're encouraged to try and make that available to those 20 providers. In addition to that, our goal is to really get our providers in this training program and get them rolling by June. Still working out some things as far as communications going out to those providers and getting that in line with that overall target start month, I should say. I'm gonna be careful and not say start date, start month in June. So look out for that. Now back to our Project Action statement and, lessons learned about computers in particular from Jermaine. Another thing I've really been focusing on is how can we in the district create opportunities for people with disabilities to really learn some of those basic skills to use tech, right? Because no matter what we do to help people get tech, if they don't have the skills to use it or are not comfortable with using it, it will just collect dust. So really focusing on collaborating with Octo's Connect DC team. If you don't know, they offer workshops on 101 soft skills around using tech, whether it's using the internet or social media, things of that nature. So I think that's a complementary piece to us, not only empowering our providers to be able to think how to use or put tech in place for people to be more independent, but equipping people with disabilities with those skills to feel comfortable with tech. So I think that is a key partnership to the initiative and the overall goal of the agency. So thank you for those lessons learned. Thank you for empowering me to stay on that track as one of the key initiatives as well.
Thanks for sharing that, Donald. I do see a suggestion here. I think that it's overdue for a moment of silence for those that we have lost to COVID-19, and for all those folks we've lost in the last year. So if we could just take 1 minute now to remember the people who we have lost here in the district to COVID-19. Thank you. Where is the written guidance that says immunocompromised people who are vaccinated should still be considered unvaccinated as far as quarantine requirements following travel and exposures? We do, as always, have folks here from DC Health, and perhaps they could provide that information to you.
I know my colleague Nelson Benucci is on. I can share that. I can share the link on CDC. He can probably give some more information about where we say it specifically in our DC Health guidance. But CDC in multiple areas have said that at this time, because there's limited data on vaccine protection in people who are immunocompromised, those with immunocompromising conditions should continue to follow the infection control guidelines because of that, because it is again, limited data on vaccine protection in those people who are immunocompromised. So Nelson, I don't know if you have anything else you want to add, and I'm happy to also share that direct link to CDC, but Nelson can share if there's anything in our DC Health guidance.
Hi, this is Nelson. Can you share exactly where you heard that you saw that? I mean, that is correct, but that exact verbiage, I'm actually looking through the guidance now. I'm looking to see where we might say that exact verbiage because I'm not sure that that's the way that we address it. The way that we address immunocompromised individuals in the guidance is in the context of, when you're deciding, what activities and who, what groups of people can be around in a fully vaccinated group and not have to wear a mask and social distance and things like that. Those that are immunocompromised do count as unvaccinated for the purposes of making those decisions because we don't know the efficacy of the vaccine. And currently there isn't any, excuse me, standard to have a level of like a titer that can be drawn, for example, to be able to actually do a blood test and check for an established level of what we know to make someone immune to the virus, for example. And until we have that, those that are immunocompromised who may not respond the same as someone who is not immunocompromised have to be, considered in that unvaccinated category because we just don't know. And that's not to say that that might not change as we continue to learn more about the virus. And, I'm sure just as if with any other vaccination, the CDC, will finally get enough data to be able to establish, this is the titer level that, is considered immune, just like we have for chickenpox and a lot of other, diseases that can have a vaccine. So until that happens, that's just kind of the cautionary stance that needs to be taken.
I would also say, as has been the case throughout this, every decision for each person is individualized. And my hope and expectation for anyone supported by DDA would be if the person is immunocompromised, they're getting regular care from a healthcare provider. So that's who should be answering this question about all of these things, about, what kinds of mitigation, when does that person need to wear a mask? If they're going out, how is it safe to do that, et cetera? I think about, because when you start hearing the examples of who is immunocompromised, they're getting medical care, and I expect that that medical provider is giving them guidance about how to stay healthy. And so, as in any case, make sure that for each person, it's an individual decision to help that person to respect their rights and ensure their health and safety. Last week, in response to a question as to when people in ICFs can return to day programs, I mentioned the CPAC will need to be updated by DDS to include questions about vaccination. Is there a timeline as to when that update will be completed? I'll just say very soon because none of the people who can answer that specific question are on, but we're not talking about some huge revision. We're just talking about, adding this question about whether the person is vaccinated and what impact that has on their ability to go out. People should start scheduling those meetings now because folks can leave the ICFs and they should have planning about what they want to do. In the same way we talk about planning your vaccine, you should be planning your activities. It is so important that people be, to the extent possible, engaged socially, engaged physically in the community, getting out, but staying safe when they do so. And for all of us, really, that means planning because, things are starting to open up, but they're just starting to do so. And each of us makes those decisions based on our own particular circumstances, our own health, and our own comfort level. You know, different people are comfortable at different levels of exposure, as it were. And so those are the kinds of things that people should have an interdisciplinary team to talk over with them so they can make those decisions. Someone is saying, I don't exactly see the thread here, but we also operate a school. OSCE has not provided this guidance to us, but there is the DC health guidance that someone can rely on. Who are the people who are classified as immunocompromised? Is this all people residing in an ICF, or is the primary care physician making that determination? Nelson, do you want to answer that?
So we do give definition of what an example of an immunocompromised person is in several of our different guidances. It's usually located as a footnote. You can find it in those guidances. But determining whether or not someone is immunocompromised is a decision, you know, by the healthcare provider. So it's very difficult to lump all people in all situations, you know, with X, Y, and Z symptoms and situations in that category. And as Director Reese stated, it really is a conversation with the healthcare provider to determine if that person is immunocompromised. You know, is it somebody who had a short course of, you know, steroids for a while because, you know, they had a respiratory infection, you know, they were on steroids for 5 days, or is it somebody who has a condition that requires them to be on long-term steroids? You know, suppressing their immune system in that way. So, or any other condition that would suppress the immune system for long term. So, all of those are questions and discussions that they should have with their primary healthcare provider.
Which I think answers the next two questions and comments that are here. One says there's a lot of confusion among people with disabilities regarding whether we are immunocompromised. And I found a lot of confusing information out there. As Nelson said, the information that you should rely on is what you get from your own healthcare provider. And then a provider that says they screen their staff daily. We recently started allowing vaccinated people to return to work right away after travel or an exposure, which is exactly what the guidance says. You know, do we have to start filtering out immunocompromised people from return? You could correct me if I'm wrong here, Nelson, but it seems to me that the issue there is protection of the immunocompromised person. And it would be really important if you have a staff person who is immunocompromised and needs to take measures to protect their health, they should be aware of that. I don't know that. I mean, I'm fairly certain we don't have a question about that on the screening. Maybe I'm wrong. The DC health screening, does that include, are you immunocompromised? I didn't think it did.
No, it doesn't. And that's something that, you know, in your own internal policy for how you clear someone to return to work after exposure or travel, you know, is it something that has to go through occupational health, or, you know, however you operationalize that. But if someone is immunocompromised and they know they're immunocompromised as an employee, you know, they should take measures to protect themselves.
So there's just a comment here. The message of ask your doctor is not getting out there. I mean, the CDC provides the guidance. This is what immunocompromised means. It just seems that when I have looked at that list, there's no one on that list who's not seeing a doctor regularly. And then someone here says, the guidance says, if you're immunocompromised, you should discuss this with your healthcare provider and follow their advice. Oh, thank you. I have what would be the word? Just tremendous appreciation, respect for all of the work they are having to do right now at DC Health to stay up with what is the latest guidance and then update the guidance for all of us. So, I appreciate what an enormous task that is. And I would really invite people to make sure that you're checking in regularly to the website, because then you can see the updates as they make them. I cannot imagine how challenging to keep up to date with all of this, but they are, I think, doing quite a good job of keeping their guidance up to date and as thorough as possible. The guidance for supported living and CRFs uses cloth face covering throughout. Can you clarify on this expectation? This can cause some confusion. I think that where it refers to cloth face covering is for the people living there, not for staff.
That's correct, Dr. Reese. Yeah.
Right. And so it's, this is what I use whenever I go out or when I leave my office and walk down to refill my coffee cup repeatedly throughout the day, is a cloth face covering, which is what the guidance requires of most of us in our daily lives. From a provider, we need a list of day providers currently operating so that we can help people reimagine their days. Kirk suggested a forum for day providers to present next week. We need the list as soon as possible as people are having these discussions. For one, there is a day provider meeting that's coming up. I think it's actually on the 27th, if I'm not mistaken. And, teams should be aware of the day provider that the people they support were using, so we'll forward those suggestions. So this is directed to Amy, but I'm sure for everyone, UCP is accepting participants. And I will say one thing, the guidance regarding day services is being updated. The guidance will address issues about, PPE, social distancing required in day programs. I will also say that the only guidance out there regarding the number of people in a particular day setting is in the DDS phase 2 reopening, and we've moved well beyond that. So we'll be issuing something very shortly, just clarifying that the source of the guidance that you should be following is DC Health. And so, one of the things I have gone back and read as we spoke with DC Health about the day program guidance is the day program best practice guide that was developed by a group of folks, including DC Health providers, DDS, and that best practice guide includes links which then update according to current guidance. And so, where guidance in the best practice guide referred to CDC recommendations, the updated CDC recommendations actually are in the, you actually get to the updated recommendation, so that what's very helpful is both DC Health, I believe, regularly, and CDC update the links that they have, as opposed to the link dying and you get a new one. So that document is still something that's very helpful for providers to refer to as they're considering the possibility of increased day services being provided. I really paused because, day programs reopened some time ago, but it has been quite a challenge because there are a number of people who've been unable to attend. I'm going to pause for a minute because I don't see that we have an interpreter interpreting. There seem to be some connection issues, and so I want to wait until I see that the interpreter is with us. So we now, every time I think I have the interpreter back, she seems to freeze. There we go. So I am still a bit confused because the purpose of people isolating or quarantining is to protect other people, not themselves. From what was said last week, I was concerned that immunocompromised people were not necessarily being protected by the vaccine and thus contracting the virus from an exposure. If they return to the program, they could then spread it further. I appreciate some of the clarification, though. I consider the importance of immunocompromised people consulting with their doctors about the steps that they should take. Absolutely. And when we think about the IDT meetings where the community participation assessment and questionnaire is completed, where people have medical issues, we need to make sure that there's medical advice about the implications of those medical issues. Another provider, Health and Joy, is currently providing IDS services, and they've provided contact information in the chat. Also, the supported living and CRF guidance notes that people must still keep 6-foot distance with people not living in their households, which would include visitors, which contradicts the ICF guidance. Do you care to address that, Nelson?
So that's a generalized statement, probably at the beginning of the guidance. And so in general, you should still social distance with people not living in your household. And I believe that later on in the guidance, specific to visitors, that it gives the circumstances where that is not the case and the exceptions for that.
Director Reese, I'm not sure if you could see it, but there is another question above we're happy to address about the ICF guidance as well.
Oh, thank you. So the ICF guidance notes that if all staff and people in a home are vaccinated and the visitor is vaccinated, the visitor still has to wear a face mask and stay 6 feet from all other staff and other persons at the home. Is that going to change in the updated guidance?
Nelson can also chime in, but when we wrote that into guidance, again, we are still wanting to, we want to make sure that the visitors are going to interact with those that they're intending to visit and still continue to minimize exposure regardless of vaccination status for other persons supported in the home, especially because of, again, the population in ICFs. We want to just take a more cautious approach. So for visitors coming into the home, for those that they're not intending to visit, other persons supported in that home, we still do want them to socially distance from them and wear masks when they're around those individuals and also staff. And Nelson, I don't know if you have anything else you want to add.
Nope, that's correct. It's in the context of just mitigating that risk for someone coming into the home who's not, who other people living in the home, it's not their visitor necessarily, right? So they're not able to be involved in the decision for that person to come into the home, and it's really to protect others in the home, because we have seen, not in particularly this example, but in other settings where visitors coming in have claimed to be fully vaccinated and are not, and we've ended up seeing transmission and things like that. And so until there's really a really good way to, like a national database or something, I'm only speculating at this point, but a way to verify someone's vaccination status, it's, you're really taking their word for it. You can't even always rely on, a card that's from the CDC, because I think you can buy those on eBay. So, it's really, it's a mutual trust between the person being visited and that visitor, and that may not be the relationship and the risk discussion between other people living in the household. They don't have a choice, and so they still have to be protected, even though it's not their visitor.
PSI Services is also providing individualized day services, employment readiness, day habilitation, and supported employment. NCC also open and offering day habilitation and companion services.
Director Reese, if I could jump in for a second. In the meantime, before a list is generated or before we kind of get to a further point with our day programs, I really urge residential and other providers to reach out to the day programs and services that they utilized prior to the pandemic and the public health emergency to just kind of check in to see where they are. Because, my thought here is that if somebody that you supported was going to a particular service before the public health emergency, they may want to return to that service or return to that program, and are a little bit more familiar with that program. So I do urge residential providers during this planning time to reach out to those day providers that they used to interact with. And also, I also encourage day providers to do the same with the residential providers and other providers that they used to work with prior to the public health emergency. Thank you, Director Reese.
And just by way of update, we got what I hope will be our final question from Centers for Medicare and Medicaid Services about our Appendix K, which we responded to today. So we hope that will be approved very soon. And at the same time, the Centers for Medicare and Medicaid Services did publish their guidance this week, which we're still going through, working with DHCF to try and fully understand the guidance regarding the enhanced FMAP that has been included in the American Rescue Plan Act that recently passed. And it requires us to develop a plan within 30 days. So we will be working with DHCF and keeping people posted as we have updates about that. Innovative Day is also open. Art Enables is providing supported employment and employment readiness. VOCS is open to provide day program services. I think providers are reaching out. This just seems like a great opportunity to help people do some different things and imagine their days and lives differently. This is why we want to be able to present a full array of opportunities and choices for people, which is why a forum is a good idea right now. I agree absolutely, because I do think one of the things about this last year is not only has it been challenging, but it's also caused us to look at how we do things overall. My hope is that as we move forward, we will have that very individualized decision-making with each person about how they want to live their lives. And so, what that's going to mean in each case is, like you say, probably a better understanding of what all the options are to support them in those individual choices, so that rather than saying, I'll go to this day provider for the week and then work out with them how I spend the week, they may be making decisions about, mixing and matching there and making real decisions about how they want to spend their week, and then finding the providers who can support them with that. Brookland is open. FESCM also is open, providing companion services. And so visitors coming to their residential homes, they still continue to monitor, which, as a reminder, all of our providers should be continuing to do the same screening for any visitors coming to the home. Checking the temperature, having the screening questions, continuing to exercise the same caution that we need to have been exercising for the last year. Our numbers are looking better because of vaccination, but we have to continue to be vigilant. Project Redirect is It says opening and providing, but I think they've been open for quite some time. I visited there in November, providing IDS, day habilitation, employment readiness. I was doing really good till we got to SES. Maybe it supported employment service, but anyway, active treatment and companion services. If I got any of those acronyms incorrect, please let me know. Yes, Project Redirect opened November 16th, which was very close to the date I was there. UCP is offering small group day with morning and afternoon sessions as well as companion services. And I want to say that the flexibility and creativity that our day providers have had to have to survive and to meet the needs of the people we support, because they are different, and as this pandemic progresses, they will continue to be different, and it's required a level of creativity that, for many of our providers, I've been very impressed with their ability to step up and adjust their services based on people's current needs in each moment of this ever-changing pandemic. So it's just about 1 o'clock. I want to remind people that next Saturday, Mayor Bowser will be having the second it's the DC COVID-19 Community Core neighborhood outreach to provide education and help people in the community make plans for getting their vaccination. 1,000 people came out a couple Saturdays ago. There'll be a second event this coming Saturday in all 8 wards of the district. And as I said, we have a little ways to go still with natural homes. So reaching out to our neighbors in the community to hear from them about, sort of where they are about getting vaccinated, to share, for those people who are comfortable, share your own story about your decision to be vaccinated, and hopefully get us to a place in the district where there's enough people vaccinated that we really have reached that point where it is safe to go out without masks, that we really can move into the next phase of this. We are making really good progress, but we still have more to make. People can, I guess we will send out information about how people can register if you wish to volunteer for next Saturday's event with the mayor in your own ward, in your own neighborhood, talking to your neighbors about the importance of getting vaccinated so that in the District of Columbia, we can be fully reopened. Want to make sure I mention. So Circle of Care Quality Services is open, providing companion IDS services. And it is now after 1 o'clock. So thanks to everyone. and we will be talking again next Friday. Thank you very much.